name is Tiffany Lamb, and today I'll be discussing fentanyl. What is fentanyl? It's a synthetic opioid pain reliever and Schedule II prescription drug, meaning it's defined as a drug with a high potential for abuse. It's 50 times more potent than heroin and 100 times more potent than morphine, so it's pretty strong, and a small dose of fentanyl can create similar or greater effects in the body than its counterparts. Those are two types. Fudge! Okay. Hi everyone, my name is Tiffany Lamb, and today I'll be discussing fentanyl. What is fentanyl? Fentanyl is a synthetic opioid pain reliever and a Schedule II prescription drug, meaning it's defined as a drug with a high potential for abuse. It's 50 times potent than heroin and 100 times more potent than morphine, so it's pretty strong, and a small dose of fentanyl can create similar or greater effects in the body than its counterparts. There are two types of fentanyl, pharmaceutical and non-pharmaceutical. Pharmaceutical fentanyl is prescribed to manage severe pain, often for patients with advanced cancer pain or for end-of-life palliative care. Sometimes it can be used to treat patients with chronic pain who are physically tolerant to other opioids. Pharmaceutical fentanyl is prescribed in the form of transdermal patches, tablets, nasal sprays, and lozenges. Non-pharmaceutical fentanyl is illicitly manufactured fentanyl that's often mixed with heroin and/or cocaine to increase euphoric effects. Non-pharmaceutical fentanyl is usually pressed into counterfeit pills. So what are the effects on the body? Obviously an intense but short-term high, a temporary experience of euphoria due to the release of endorphins, and as mentioned before, this can be intensified when fentanyl is mixed with heroin and/or cocaine. Slowed respiration and reduced blood pressure can also be seen as a calming and relaxing effect of fentanyl. Besides those primary desired effects, users can experience not so desirable side effects like nausea, fainting, seizures, and in worst cases, death due to overdose and/or abuse. Fentanyl's chemical structure is much more complex than that of heroin or morphine. It reaches the opioid receptor in the brain faster because it can easily pass through the fat in the brain. Once there, it hugs the receptor so tightly that a tiny amount is enough to start the molecular chain of events. Because of its tight grip on the receptor, it's harder for antidotes like naloxone to remove fentanyl off the receptor than it is to remove morphine. It sometimes means that more naloxone is required to combat a fentanyl overdose than a heroin overdose, although it may not always be able to revive the person. So what are some risks and consequences to abusing fentanyl? Of course, illegal drug markets sell fentanyl mixed with heroin and/or cocaine for a higher potency and stronger effect, and this is often done with or without the user's knowledge. So people who are purchasing what they think is highly potent heroin may not realize fentanyl is mixed in. Thus, heroin laced with fentanyl can create a deadly dosage, which can lead to overdose and/or death. Illegally made fentanyl in general is often the cause of fentanyl-related abuse, overdose, and death in the United States. Another risk is the potency. Fentanyl is much stronger than heroin. As shown here, 3 milligrams of fentanyl is equivalent to 30 milligrams of heroin, and these are both legal doses. Fentanyl sold on the streets is less pure than fentanyl made in a pharmaceutical lab. Of course, this impure substance can have a more unpredictable effect in the body, another major consequence of buying illegally made fentanyl. Fentanyl on campus, and as discussed before in class, the opioid epidemic is very prevalent among college students. Young adults between 18 to 25 are most vulnerable to opioid abuse, and most begin experimenting in their teens and can progress into college if not treated. On some college campuses, 1 in 4 students are abusing opioids for non-medical reasons. Fentanyl can be prescribed to students for certain medical conditions, which can lead to some students abusing it and reselling it to other college students. A way to combat this epidemic is to start noticing signs of opioid abuse on your campus and among your peers. Is he or she displaying irregular sleeping patterns? Are they gaining or losing a significant amount of weight? How is his or her academic performance? Is she cutting classes? Is he losing interest in previous activities? How about the mood? Is he or she becoming temperamental? Are there signs of depression or extreme tiredness? If for any reason you start to notice a peer displaying these signs, please approach them calmly and with a lot of care. Oftentimes, drug addicts just want to confide in a trusted loved one and talk about their issue. So be compassionate, listen to their problem, and start a healthy conversation with them and discuss the next steps. Hopefully, you'll be able to encourage him or her to contact a rehab specialist. Other ways to combat the opioid epidemic is to expand the use of naloxone. This requires much more research and development of safe and effective antidotes to opioid-related overdoses. Health professionals should consider conducting trainings on how to administer naloxone, especially to persons at risk for overdose and their friends and family members. Another would be to improve access to drug treatment and recovery services so drug abusers and addicts can receive the help they need before it's too late. And lastly, advancing better practices for pain management can help reduce the need and possible misuse for fentanyl and other drugs. I hope this gave you a bit more insight on the world of fentanyl and that you become more mindful of your peers that may be struggling with it. Thanks for watching.